Today, we're diving into a comprehensive review on meat intake and its impact on health burdens. Let's get started.
Oh, I've been really looking forward to this topic. So, what's the big picture here?
Well, a recent review by Yip and colleagues summarizes the associations between meat consumption and various diseases. They've found that meat intakes are statistically associated with 21 different health burdens.
Wow, that's a lot. So, which types of meat are we talking about?
Mainly processed meats and red meats. Processed meats, in particular, are linked to higher risks of cancers, and not just one type, but multiple cancers, as well as cardiovascular diseases and diabetes.
Okay, can you elaborate on the risks associated with processed meats?
Absolutely. For example, the review found that per each 50-gram increase in processed meat consumption, the risk of esophageal cancer increases by 81%, and stomach
That's
cancer
huge.
by 71%.
Wow, so eating just 50 grams more could nearly double your risk?
Exactly. And for coronary heart disease, the risk increases by 42% per 50 grams of processed meat.
That's pretty significant. So, processed meats are clearly problematic. What about red meat?
Red meat also shows positive associations with certain diseases. For instance, every 65-gram increase in red meat intake is associated with a 36% increased risk of endometrial cancer and
Interesting.
25% increased risk of esophageal cancer.
So, both processed and red meats carry risks. But are there differences in the level of risk between them?
Definitely. Processed meats seem to have higher relative risks compared to unprocessed red meats. It's like processed meats are the heavy hitters in terms of health risks.
Right, and what about poultry or white meats?
Interestingly, poultry meat was found to have negative associations with certain health outcomes, especially in low meat consumption countries in Asia. For example, higher poultry intake was linked to reduced risks of all-cause and cancer mortalities in those populations. It's a bit of a contrast to what we see with red and processed meats.
So, in some cases, eating more poultry might actually be beneficial?
Exactly. But it's important to note that these benefits were mainly observed in populations with generally low meat consumption overall.
Got it. So, does this mean that the effects of meat consumption differ across populations?
Yes, that's one of the key takeaways. The researchers emphasize that current global assessments might underestimate the health burdens associated with meat intakes, and that more research is needed, especially in low meat consumption countries.
That makes sense. So, do they discuss any potential reasons for these differences between populations?
They suggest that it could be due to differences in baseline meat consumption levels, genetic factors, environmental influences, and even cooking methods. It's a complex interplay of factors.
Right. And what about confounding factors? Did the review address them?
Yes, they acknowledged that residual confounding is a limitation. Many of the studies adjusted for various confounders, but it's nearly impossible to account for all possible variables.
So, interpreting these associations requires some caution.
Exactly. And they call for more robust research, including in different regions and populations, to better understand the relationships.
That's fair. But, do they mention any benefits of meat consumption? I'm just thinking meat isn't all bad, right?
Well, they do point out that meat provides essential nutrients, especially in undernourished populations. So it's not about eliminating meat entirely, but finding a balance.
Right.
But considering the significant risks associated with processed and red meats, reducing intake could be crucial.
But don't you think that, focusing too much on these risks might overlook the benefits? Like, for some people, meat is a primary source of essential nutrients.
That's a valid point. But the review suggests that in high meat-consuming populations, the risks outweigh the benefits. It's important to weigh both sides and make informed decisions.
I see what you mean. It's a complex issue.
Yeah, it really is. Dietary recommendations need to consider individual contexts.
So, are there any specific recommendations on how much meat is safe to consume?
The review refers to existing dietary guidelines, like the World Cancer Research Fund's suggestion to limit red meat intake to less than 500 grams per week,
Okay.
and to avoid processed meats as much as possible.
So, cutting back on that daily ham sandwich might be a good idea.
Ha! Exactly. Small changes can make a big difference.
Are there any other interesting findings in the review?
They also found that current global assessments might underestimate the health impacts of meat consumption. So, the actual health burdens could be higher than we think.
That's concerning. It seems like policymakers need to pay attention to this.
Absolutely. The review suggests that more attention is needed to promote lower and healthier meat intakes in high meat consumption populations.
Yeah, makes sense. So what can individuals do?
Well, being mindful of meat intake, especially processed and red meats, is a good start. Incorporating more plant-based foods and choosing poultry or fish over red meats can help.
Sounds like practical advice.
Definitely. It's about making informed choices and finding a balance that works for your health and lifestyle.
Right. Well, this has been really enlightening.
I'm glad you think so. It's an important topic that affects many of us.
Yeah, I'm going to rethink my lunch choices from now on.
Me too. Ha! Maybe time to explore some new recipes.
Absolutely. Thanks for sharing these insights.
My pleasure. Thanks for the great discussion.